Hello, everyone. I hope you are enjoying your day so far, and I hope you enjoyed your last session. My name is Brittany McNamara. I'm the Development Director for the Children's Coalition for Northeast Louisiana. Before we get started, I want to go over a few quick housekeeping items. You can chat with our speaker and myself in the chat box. And if you're having any tech problems, you just feel free to chat me. If you have any questions, please type them in the Q&A box, and we'll have time for a Q&A at the end of the session, so don't hesitate to just add any questions that you have as we go along. So let's jump into our exciting session. I'm excited to introduce Dr. Julie M. Rutledge. She is the Mildred Trussell McGee Endowed Professor in Human Development and Family Science and the Director of the Education and Research and Children's Health Center at Louisiana Tech University. Thank you for being here, Dr. Rutledge. The majority of her research focuses on using the early childhood education setting as a catalyst for positive health change in the lives of preschoolers and their families. With funding from private health foundations and federal funding, she is focused on using the framework of implementation science to develop and implement evidence-based programs focused on nutrition practices in early care and education, and testing their effectiveness and sustainability. So without further ado, I'm going to turn it over to Dr. Rutledge, and thank you so much for being here.
Thank you so much. I will share my screen. All right, good morning. I'm really excited to be here today and share with you about some of the work that we are doing. And so during our time together today, going to contextualize the work that we do around children's health, share some of our programs and their outcomes, 3 specifically, and a little bit about what's next. Before I jump in, I have a few really important acknowledgments. First is to our community partners, our Head Start and Early Care and Education program partners, and the families, teachers, administrators, and early childhood professionals on our advisory and program boards. My research partner, Dr. Taryn Massey Swindle, who is based in Arkansas, and our joint research team, we call ARLA for Arkansas, Louisiana, and my team at the Enrich Center at Louisiana Tech. The work that's being presented today comes from 3 funding sources: the National Institutes of Health, the Vitamix Foundation, and the Lincoln Health Foundation. I'd also like to acknowledge the School of Human Ecology and our director, Dr. Amy Yates, and none of this would be possible without the love and support of my family. In sharing with you about our work, I want to begin with the end in mind. So across the vision of the research program that I've been working on and will continue to work on, our vision is using an implementation science approach. We're working to create a continuum of care in early care and education settings to positively impact child health outcomes in marginalized communities. And I'm sharing that with you since I will be sharing 3 different programs. What we're trying to build is that at the end, we can meet a community partner where they are and have an evidence-based tested program that we can share with them based on their needs. So as we're starting to think about children's health, what matters most? Is it research, like what I do? Is it policy? Is it the focus areas of the funding sources that provide funding to early care and education, or to researchers, or to policymakers? Is it the needs of children, the needs of families, the needs of teachers? What matters most? In our work, caregivers tell us they don't want to know as much about the long-term implications, but rather, what do I do right now in this moment with this child sitting in front of me? They have a desire for feeding to be easy and for children to like eating the food they're served. They want to learn about how to help children accept new foods. And they want to learn how to interpret children's cues. When are they rejecting the food because they don't like it? And when are they just unsure because it's new? They want researchers and policymakers to understand their goals and values related to meal times, and they want to understand what's developmentally appropriate for children. In other words, what's realistic to expect in real life with real children who are growing and learning as we would expect. They want to know how to handle when real life doesn't align with their goals and values and or the goals or values that have been prescribed to them by others. They also just want to have connection with the children in their care, and they want to have fun. Oftentimes our shoulds from science and best practice and policy and governance leave these important considerations out. I would argue they can all align holistically to partner with children, families, teachers, and early childhood programs to create fun, hands on, connected experiences that are grounded in best practices around whatever it is your focus is. Mine is food for young children that create lifelong health habits that can lead to better health outcomes for children. In these situations, everyone's voice, goals, and expertise come together for our children. As I'm sharing with you today, I would like for you to think about the ways that you directly or indirectly work with children, families, schools, community organizations, policy, research, practice, whatever you do, in ways that can impact their health. I'm going to be focusing on nutrition and those kinds of health outcomes, but you can add in for yourself whatever you do, whether it's mental, school readiness, whatever works for you. And think about these three questions. What are the primary health concerns that you have for them? What are ways you are already working with or for them to address these concerns? And what barriers do you or they have in making change? Those are the places where we can make a difference. So first, putting our work in context. What, where, and who we do the work we do, and our theoretical foundation and scientific framework. The what, where, and who. And the pictures that you'll see on some of these slides are from children doing our nutrition program. We focus on child health outcomes because we have known since the heyday of Elton John and Stevie Wonder, the 70s, that diet is just as much a cause of cancer as smoking. And yet, these statistics are all current. Very few preschool children meet daily dietary guidelines. About 40% are overweight or obese by the age of 5. About a third of children 2 to 19 are obese. And once they are, they have about an 80% chance of maintaining that into adulthood. We also, some more recent research is showing that for every 1% increase in low income, there is an related, a little over 1% increase in overweight or obesity status. So the lower the income status of the family, the higher their increase of overweight or obesity. We also know that COVID exacerbated these overweight and obesity rates in families. So this is still a very current health crisis. Where we do our work is in Arkansas and Louisiana, which is right at the bottom of the lower Mississippi Delta. This region has been described as being replete with challenges in virtually every area of societal and social development, health, education, economic conditions, and obesity and obesity-related diseases are higher in the lower Mississippi Delta than in other parts of the United States. And many factors that both directly and indirectly impact obesity can be found here. Most of us think about these as ACEs or social determinants of health, things like educational status, poverty, and food insecurity. And we typically find the lower in the South we go, the higher the obesity rates. Children who are 6 to 19 are more at risk of being overweight or obese than children who are 2 to 5. So the preschool age children, meaning that is a prime time for intervention. If you are a numbers person, I pulled these numbers for us to take a few minutes to look at. This is from the 2024 State of Obesity Report, and this is the Arkansas and Louisiana rankings for obesity and overweight, except they didn't have rankings for children who are 2 to 4 experiencing limited income in their families. We are in the top 10 in every category. And in every single category but 2, we are in the top 5. In some, we are 1 or 2 or 3. So this is a very current, serious issue for us in Louisiana. Just if you're this is overall obesity and overweight. And then starting here, it's the obesity ranking for those categories, gender and age groups. Who we partner with are early childhood education programs that serve underserved children and families. Our most valued and frequent community partner is Head Start. And it was in Head Start that we did our formative evaluation for this grant or for this program. And when we did that evaluation, we found that about 1 in 4 Head Start children had not tasted an apple at home. Programs shared with us that budget and food waste were major concerns. Teachers thought that nutrition is the family's job, and families thought that nutrition was the teacher's job. So you can see how that could fall through the cracks. We also found that teachers often mirror families they serve in income and nutrition barriers. So that led to our focus. Our focus was creating a nutrition curriculum that was budget conscious. It values fresh, frozen, and canned things that are readily available in grocery stores and farmer markets and in the communities. And it became our job to provide exposures to fruits and vegetables so that families didn't have to, so that we were coming together to inspire smart eating. And that together is based on our theoretical framework, which is the bioecological systematic approach from Bronfenbrenner. The idea that a research program can influence an early care and education program, which can influence a family, which can influence a child. So what's critically important is that we're translating our theory and our research and our policies into everyday practice in early care and education programs that can positively support children and families. So that means that what we do as fill in the blank with whatever you are, researcher, practitioner, service provider, policymaker, what we do has an actual tangible influence in our community, for a school, for a family, and for a child. Oftentimes, especially with research, there can be up to a 20-year gap between determining the effectiveness of a program and its implementation in a community setting. Our scientific framework is implementation science. The academic definition of this is it's a field of study of methods to promote the systematic uptake of research findings and other evidence-based practice into routine practice, and hence to improve the quality and effectiveness of the practice. Dr. Jeff Curran is considered the father of implementation science, and he is an investigator on many of our programs, and he says it much better. He says you have a thing that you want people to do. You have a program or a policy, something that you want people to do. And that thing is based on research findings and evidence-based practice. And then you study the best ways to help people do the thing now and in the future. In other words, you create the thing. And when you're creating the thing, from day one, the end users, whoever is going to use your program, policy, practice, whatever it is, they are in the room from the very first day, and their voice is at the table in the development of the program. And then you test the thing for effectiveness. Does the thing work in the setting or the context it was created for? So then you study the best ways to implement the thing in the setting it was designed for, and what supports help people do the thing now, keeping in mind that in the future you want more people to do the thing and you want them to continue to do it long after you're unable to provide support anymore. Now to our programs and outcomes. The first program I'll share with you is our preschool curriculum. It is called Together We Inspire Smart Eating, or WISE. It's a classroom nutrition curriculum that's designed to increase preschoolers' exposures to 8 carotenoid-rich target fruits and vegetables. We promote 4 evidence-based practices, and each of these practices aligns with the Academy of Nutrition and Dietetics benchmarks for nutrition and childcare, and it has been reviewed and approved for inclusion in the USDA SNAP-Ed Toolkit. You can find it there. From the curriculum side, this program meets Head Start and Common Core standards. It's also crosswalked with TS Gold, Creative Curriculum, and Frog Street standards. And on the recipe, the activities the children do in the classroom, the recipe is aligned with the Child and Adult Care Feeding Program guidelines, which helps enable programs to continue to fund it after research funding is gone. WISE happens at school. Teachers are key to the success because of their really important role in children's lives. When programs are involved with WISE, we've added up and there are over 576 opportunities for positive role modeling around food when you have breakfast, snack, lunch, and weekly WISE food experiences. When programs partner with us, we provide 6 hours of professional development training, over $200 value of curriculum materials for each classroom, and they get 1 year of ongoing support from our team as they're getting the program started. And through generous partnership with the Vitamix Foundation, some of our classes receive a Vitamix blender in order to make the recipes, which is about a $400 value. An overview of the numbers, we have 8 target fruits and vegetables that are carotenoid rich. As I said earlier, they can be found fresh, frozen, and canned, and all grown locally in the South. If you're very interested, they are apples, tomatoes, sweet potatoes, bell peppers, carrots, berries, greens, and green beans. And we are in November right now, so our target food is sweet potatoes. Each month focuses on a different fruit or vegetable, so that allows for multiple exposures to the same target food across the month at school. Based on the feedback of the families and programs in our early development work, they are simple, low-cost recipes, and there are a variety of recipes to meet the developmental needs of the children in the classroom because they can range anywhere from 3 to 5 years old in a preschool classroom. Each month follows the same routine of 4 activities. A letter from the farmer arrives introducing the target fruit or vegetable and introducing children to a variety of ways that we can grow food, from container gardening on an apartment balcony to grandparents' garden in the backyard to a large corporate farm. The food arrives each month from the farmer, and then they have a sensory exploration activity and then authentic weekly food experiences across the month. Our 4 evidence-based practices are role modeling, and that allows children to observe a trusted adult interacting with the target food, repeated hands-on exposure that supports children's food acceptance, positive feeding practices, which supports children's self-regulation and autonomy, and mascot use, providing a friendly, familiar character associated with target foods. Across the day in the classroom, teachers have the opportunity to model, teach, and encourage healthy food attitudes. Our work has shown that children can pick up lifetime attitudes and habits by watching a trusted role model, and they're more likely to try new foods when the teacher provides this healthy role modeling. Teachers' feeding practices are important because those meal times can set the lifelong patterns. What adults say and do during a meal has both an immediate effect on the children's interpretation of what they're eating and a long lasting effect. And we have also shown in our work that children benefit from a pleasant environment with positive conversation. We talk to teachers about this, like, you're setting the stage for them to be willing to try something they may have never had the opportunity to try before. So just like at nap time, when we create an environment for their body to rest by turning the lights down and speaking in a low voice and maybe turning on some calming music. At mealtime, and snacks and WISE experiences, we're setting a pleasant environment for them to be excited and engaged. Our third is mascot use. The picture there is Wendy Wise. She is a barn owl and she is our program's mascot. I don't have to convince you, and neither does research, that children are more likely to prefer foods associated with familiar character because all you have to do is go down the candy, snack, or cereal aisle at the grocery store and you will see characters on all the things for children. We know that children are more likely to try new foods when the teacher is providing healthy role modeling and it's associated with the fun of the Wendy puppet with the WISE lesson. We have found that children often talk about Wendy with their families. So Wendy is our link from farm to classroom. She flies to a different farm each month and brings back a letter from the farmer. And then she's also the link from classroom to home. And in WISE, we love Wendy. Here are some pictures from Wendy in different classrooms and with some of our research team. In the upper left, that picture is from just a couple of weeks ago at a class here in Louisiana where they dressed up Wendy for Halloween there. And then the picture in the top middle and the bottom right of the trees, that is Wendy, where Wendy hangs out in the classrooms whenever they're not having a WISE lesson. So these are just some of the ways that Wendy has been incorporated, and you can see the fun that the classrooms have with Wendy as part of one of their new friends in the classroom. The last goal is repeated hands-on exposure. Preschoolers should spend as much time as possible actively doing. We know from child development, the more actively involved they are, the higher engagement they have, the less behavioral challenges that teachers experience. And small groups can help us to individualize and make sure everyone has a role. On the nutrition side, repeated hands-on exposures results in children's increased willingness to try, intake of, and liking of fruits and vegetables. So although I could share lots of outcomes, I've narrowed it down to 5 to share with you today from our WISE program. We have shown improvements in educator knowledge of nutrition, which is sustained. It outperforms standard of care for improving children's dietary intake. And then we also talk to parents. Even though the program happens at school, we are hoping that it is affecting change at home. And we have found that parents report increase in children's intake of our target fruits and vegetables, and we support that by a physiological measurement of their carotenoid levels at the beginning and end of the year, and that supports what parents are reporting. We also have something we have called pester power, and that is the power of children pestering their parents to buy Wendy's fruits and vegetables or make the recipes that she is making at the classroom at home. And we have found that children who use this pester power, they have higher intake of WISE foods and more improvement in related parenting practices at home. And interestingly, even though we don't focus on this directly with WISE, parents reported significantly reduced fast food and sugar sweetened beverage consumption after a year of WISE exposure. Our current WISE funding is through the National Institutes of Health National Cancer Institute, so it's funded as a cancer prevention program. And essentially what we're doing in this is some programs hit the ground running. They have the resources and support that they need to do WISE well, and others, based on resources or other challenges that we see across early care and education programs, need a little extra support. And so we're looking at what is the difference in child health outcomes by us being able to adapt or individualize or tailor the level of support that we provide, but also the more tailored or individualized support, the higher the cost for supporting the program. And so we're also looking at the cost effectiveness of that. The second program I'll share with you is WISE Words. WISE Words is a de-implementation program. In other words, it's focused on decreasing or de-implementing the use of inappropriate feeding practices in the classroom for teachers. So this isn't necessarily around WISE, but it can support WISE. So in WISE Words, we focus on 5 evidence-based practice start goals and 5 evidence-based practice stop goals. So something they want to start doing more of at meal times and something they want to not do as much of. So when you put WISE and WISE Words together, the long-term goal of our work is to increase the use of evidence-based feeding practices, because we know that supports healthy weight trajectories and diets, but it also decreases the risk of later serious diseases like heart disease, diabetes, and obesity-related cancers. I believe there's around 13 of those. But research shows that many early care and education settings use inappropriate practices that are not supportive of children's intake of healthy foods, like encouraging them to eat beyond their body's fullness cues. What we have found, though, is often for teachers when they do this, this is coming from a place of deep love and care and support for their children based on their knowledge of them. But we know that reducing unsupported feeding practices and increasing the use of evidence-based practices is really important for children's health outcomes. So this randomized trial is going to allow us to test the effectiveness of some strategies to reduce those inappropriate feeding practices and increase the supportive feeding practices. In our pilot work with this, we know which unsupportive practices we need to target, and we expect to be able to show which strategies best support teachers. And this was very recently funded by the National Institutes of Health, National Institute of Diabetes and Digestive and Kidney Diseases, which is a mouthful, and we are really excited to move this work forward. The last program I'll share with you about is Wise Babies. And Wise Babies is funded through the Vitamix Foundation, and it is the adapted curriculum of Wise that is developmentally appropriate for birth to 3. So Wise is for preschoolers, 3 to 5-year-olds. Wise Babies is for birth to 3. We have an infant curriculum and a toddler curriculum within Wise Babies. Infant is really focusing on supporting early care and education centers with breastfeeding, responsive feeding versus feeding at a specific time, complementary feeding. So when you're supporting breastfeeding and transitioning to solids. The toddler curriculum adapted the evidence-based practices in developmentally appropriate ways, but it also focuses on laying the groundwork for feeding self-regulation, satiety cues, and motor skills for feeding. Our data from our pilot work suggests that Wise Babies is acceptable, feasible, and appropriate to teachers and can be delivered with fidelity. The teacher survey showed us that 100% of the teachers agreed or strongly agreed that Wise Babies was appealing to them. It met their approval and was welcome in their classroom. We also measured fidelity, and the overwhelming majority of the teachers were able to meet fidelity for feeding practices, hands-on exposure, and role modeling. So this pilot work is what was needed in order to move to the next step, which is a randomized controlled trial testing for effectiveness, and that grant is under review. Fingers crossed. We have literacy embedded in all of our programs, and so I pulled out the literacy component related to the 3 programs I shared with you. First, for Wise, we have Wendy Wise Adventures, and this is a series of 8 books that focus on what happens when Wendy flies away each month and goes to the farm. So the children get to learn about the farm and the way the food grows. And then we have, for Wise Words, we have a series of books called Wendy Wise's Barn Tales that are tools for educators to use in the classroom to talk about the START goals, and it also models to the reader, presumably the teacher, best practices. And for Wise Babies, instead of providing a letter from a farmer each month, it's a series of books that introduce the target foods and their farmer friends in a developmentally appropriate way for toddlers. So what's next? Our short-term project funding goals are continuing the funding that we have right now from NIH, and then we have the randomized control trial under review for Wise Babies, and we have a project under review also with NIH for Wise Home Visiting. So that is adapting the Wise curriculum for home visitors. Our long-term goals are for each one of these projects, we are moving through the phases I talked about with implementation science, development, effectiveness testing, implementation strategy, scale up, and sustainment. We also plan to add in a few other areas like Wise Words at Home for caregivers and capacity building. So maybe before we can go in and do anything, we have to work with programs to help them build capacity to take on something new. And as always, we want to meet the emerging needs of our community partners. So at the beginning, I shared with you our vision, and that's using an implementation science approach. We're working to create a continuum of care in early care and education settings to positively impact child health outcomes in marginalized communities. And hopefully you've learned a little bit about how we are working toward that vision. The food for thought I shared with you at the beginning was you thinking about what you do related to health concerns for those you work with directly or indirectly, ways you're already working with them, and most importantly, where we can affect the most change is what barriers you or they have in making change and what we can do together to overcome those barriers. If you'd like to get in touch, my information is there on the screen. Thank you so much for your time. It was wonderful to be here with you, and I think we can open up for questions.
Does anybody, I didn't see anything in the chat box or the question Q&A box. Does anybody have anything they want to type in there for Dr. Rutledge? Lindsay says,
thank-
work. Dr. Rutledge, your work is inspiring.
Well, thank you.
All right. Well, we still have a few minutes. But I just want to thank you all for joining us. If anything pops up in the chat, I'll make sure I'll interrupt myself. But thank you, Dr. Rutledge, for sharing your expertise. And again, when this session ends, the Zoom app is going to close out and you'll be brought back to the event lobby. There's gonna be a pop-up in the top right of your screen, and we ask that you just take a quick moment to take a quick survey about your session. We would greatly appreciate it. But feel free to hang out in the lobby and network. Oh, I think we got a question. Dr. Rutledge, do you see this?
Yes. For a 2-year-old very picky eater, should we present the school lunch or just give the lunch provided by the family? That is a great question. So, if you would like to email me, we actually have resources that we have developed and shared through Wise Babies for exactly this very, very common issue, which is picky eating. So, some of the things that we do to encourage children who are picky eaters is by sitting them next to adventurous eaters. Oftentimes, seeing what other children are doing is very helpful. And then we would also recommend through our work doing a mix of both. So if the child's picky about eating the school lunch, pairing a familiar food with a new food is a way to get them to even maybe just be willing to have it on their plate at first, just that the food they might not like is there. And then eventually, when they get used to that, they might be willing to try it. And also through sensory exploration. If you ask a child what a food sounds like, even though to us as adults, that sounds like an odd question, but the first thing a child's gonna do is pick up the food and put it next to their ear. And if it's a food that they don't like, or they think they don't like, well, now we've gotten them a step further and they're willing to touch it. They've touched the food, and sometimes that's the first step. So those are the key recommendations: is sitting them next to an adventurous eater and pairing the at-home food with the school food, and guiding them through some sensory exploration.
Thank you so much for the question and the answer. Do we have any more questions? So we've got probably 10 minutes or so that we, left. So if there are any more questions, it would be a good time to interact with Dr. Rutledge. That was a wonderful presentation. Y'all have a lot of great programs.
Thank you.
I was really the comment about the cereal boxes and the mascots and the fact that children do respond to that. That was great content. So thank you so much.
Yeah. I was in some centers yesterday. They were making sweet potato spread because it's almost Thanksgiving. And so they introduced me as Wendy's friend from North Louisiana, because I was in South Louisiana. And I was there to watch to see what recipe they were making. And I bent down to take a note because the teacher said something absolutely fabulous and I did not want to forget it. And one of the little boys who was so excited I was there, he happened to see me, of course, right as I bent down to write my note. And he was like, "Hey, Miss Julie, you're supposed to be watching us make our recipe so you can see how we make it and you can taste it." So he was very serious about my role in the classroom that day.
That children are some of the best advocates for change.
Mhm.
If you can get their buy-in, they're gonna put the boots on the ground for you. So I love
Yeah,
it.
absolutely.
All right. Well, I'll just remind everybody again that when we end this session, the Zoom is going to close out. You'll be back in the lobby. We do ask that you take that quick survey. And then if you can just hang out in the lobby and network until you choose your next session. I think the next session start at 10:55. So if there aren't any more questions, we can go ahead and end a little early. It might give time for people to run to the restroom or grab another cup of coffee. But we do thank you so much for being here, and we look forward to seeing you in the next session. Thank you so much, Dr. Rutledge.